This is one way to work on hip internal rotation. We're gonna work on some of the deep hip rotators and some of the deep hip capsule in this movement. This position specifically is gonna work on hip rotation in hip extension. So with our hip flexors and anterior hip on a little bit more stretch, so it just provides a little bit of a different stimulus. So for this exercise, you are going to need either a kettlebell or something heavy or something that doesn't move. You can also go on the corner of a squat rack or a doorway as well. You just want to make sure that your foot can go against something that doesn't move. So you're going to want the object to be on the inside of the ankle of the foot that we are working on. Then you're going to use either a PVC pipe or something that you can hold on to for the front as well, just to give a little bit of support in case you're really wobbly. Now, the distance or where you need to be, what we are looking for is that my ankle is outside of my knee, the one that I'm working on. So you can see that I have a pretty good amount of hip internal rotation, so my foot's out pretty far. If you don't have a lot of hip internal rotation, which you can assess by doing this is hip internal, this would be external. So internal is going out here. If you don't have a lot of it and you can't really get your foot out very far, then you just want it to be in straight line with your knee. We don't need to worry about it coming out because we can then work on finding the stretch and work on rotation now in this position. So if you have lots, you want to kind of preset that rotation a little bit so you don't have to work as hard. If you don't have a ton, then just keep your foot in line with your knee straight back. Now from here, we want to stack our rib cage and pelvis. We don't want to be kind of hanging out here. This isn't about a hip flexor stretch. So we want a little bit of a hip flexor stretch or just to be stacked. Then from here, we're going to find the actual internal rotation stretch, which is going to be thinking about your belt buckle or your pelvis rotating towards that outside of your hip, towards the outside foot. As you do that, you should feel a nice deep stretch through here, all the way through here. Most people will compensate by rotating their shoulders, and you will get your back involved a little bit, or we will come into a lot of extension. So we want to keep our ribs and pelvis together, and we just want to rotate the actual pelvis around. Once you find that stretch, you're going to push into the desired intensity and hold for the prescribed amount of time. Up to 2 minutes is typically what we're working towards. Once the stretch has been held for that prescribed amount of time, I'm going to show you the PAILs rails, which you typically will be doing at the end of a stretch, maybe not every day, but some days. So for PAILs and rails, to build strength at that end range, we are going to really think about driving, for PAILs, our foot into the kettlebell. So we are thinking about doing this motion, right? Pushing into the kettlebell. But because we are stuck here, we are not moving, we are thinking about trying to drag the kettlebell across, but it's not going to go anywhere, or drag or push our foot inside of our ankle into the doorway or whatever you're using. Ramp that up slowly and then all the way up to the desired intensity and hold for the prescribed amount of time. Then we're going to ramp that down and relax. As you're contracting, you should feel a lot of your glutes and honestly pelvic muscles kind of stabilizing, and you should feel some of the inner thigh muscles kind of pulling you out of the stretch a little bit, but we're not moving out of it. Once that is finished, we're then going to contract the rails tissues, which is going to be this stuff here. So you're going to think about trying to pull your ankle away from the kettlebell, and you're going to also think about pulling your belt buckle towards. So we're thinking kind of about doing this. So this part of our foot and our hip is kind of going this direction, but this part of our pelvis is going this direction. So we're getting something like this at the hip, kind of really contracting these muscles and working on pulling ourselves deeper into hip internal rotation. You might have some cramping, that's okay. Just don't push into the intensity too much because we want to stay right at or below that level of cramping. That should get better as you build more strength there. You're gonna ramp that intensity slowly to the desired amount of intensity and hold for the prescribed amount of time, then ramp back down. And that is gonna be one round of your PAILs rails, after which you might be done, or you might take a rest or go into your next set or next handful of sets, depending on what your program calls for. What we wanna make sure is that we don't have any sort of pain or pinching. We don't want to push into those symptoms, but as long as you don't, then you should be good to go and you should start to feel a lot more progress as you do this super consistently.